I want to welcome everybody to the Affordable Care Act Town Hall here in Moreno Valley. My name is Matt Friedlander. I'm with the United Way of the Inland Valleys. And before we begin, if everybody could stand, face the flag, we'd like to begin with the Pledge of Allegiance. I'll begin. I pledge allegiance
to the flag of the United States of America
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. You may be seated. Once again, good morning and welcome. First off, I want to thank Congressman Mark Takano, Senator Richard Roth, and Assemblymember Jose Medina for inviting me to host this morning. It's an honor. I want to announce that question and answer cards are available from the staff. You can please fill them out. Staff will collect them towards the end of the speaker presentation. For anyone requiring accommodation, a cordless microphone will also be available. At this moment, it's my honor to introduce Congressman Mark Takano, who represents the 41st Congressional District.
Hi, good morning.
Morning.
Yeah, good morning. Thank you, and I want to thank my, well, they're not exactly colleagues, we're not in the same body, but I want to thank Senator Roth and Assemblyman Medina and their staffs. I wanted to show my appreciation to my own staff who worked very hard. We all collaborated to put this event together because we're all eager to get information out to the public about how the Affordable Health Care Act is going to help the people of this county. And I want to congratulate the state of California for its robust effort to put together the California Healthcare Exchange, to expand Medi-Cal here in California. These are all going to be elements, important elements in covering more and more Californians, more and more Riverside County residents, so that we can have a healthier community, a more financially secure community. People are going to worry less and less about the financial ruin that a catastrophic health episode is going to have in their lives, because they're going to have access to not skinny plans, but plans that are going to cover them. They're no longer going to be subjected to yearly, annual caps on the kind of benefits they can get. The lifetime caps are going to be taken off. This is a huge thing. I want to just tick off some of the things that the Affordable Health Care Act has already done. Americans have saved $575 million. Seniors have saved $575 million in prescription drug savings because the ACA has closed the donut hole in prescription drugs. Insurance companies have paid back $66 million in refunds already because the Affordable Health Care Act mandates that they must devote 80% of their premiums to actual coverage. It cannot go to profits or to administration. They must spend it actually on health coverage. Riverside County residents here have actually, I think, received well, I don't have the figure in front, but they've actually received the refunds as well. I don't want to throw out a figure that's not, that I don't have a basis for. 8.1 million individuals with private insurance can now receive preventative services at no extra cost. 435,000 young adults can now stay on their parents' plan until they're 26. And here's a big one. People with pre-existing conditions can no longer be discriminated against. So I just wanted to encourage everyone here to listen carefully and visit the information tables after these presentations so that together we can spread the word that healthcare is coming soon to everybody. Thank you all for being here. It's an honor to be your member of Congress. And it's an even bigger honor right now for me to introduce a great state senator who represents our area, Senator Richard Roth.
Thank you, Congressman Takano, and thank you all for the invitation to join you at this very, very important event today. I'm glad to see so many of you are here to learn about your options for health care, because frankly, this is a very, very important issue to all of us in California. It was brought home to me in a very big way, in a very impactful way, I think about 3 months ago. I was in Sacramento. As you know, I sit on a budget committee up there, and we were hearing issues having to do with health care and dental care. And a lady stepped up to the microphone during public comment to talk to us. Let's just say her name was Bernice. And we were sitting there wondering what she was going to say. And Bernice started to talk to us about the fact that she had not eaten for days. And I was wondering why. She was begging us to find a solution to our adult dental care situation in California. And as she spoke, she asked our permission to do something. She said, "May I show you my teeth?" And she opened her mouth, and she had about 3. And that's why she couldn't eat. Now, this isn't necessarily about dental care today, but Bernice could just as easily have been talking to us about diabetes, or out of control high blood pressure, or a high-risk pregnancy. You know, our California legislative analysts suggest that 6.7 million Californians are uninsured, and that over 16 million non-elderly Californians have some type of pre-existing health condition that they have trouble getting care for. And that includes over 2.2 million children. Now that's a problem. And more than that, for the uninsured or the underinsured, a serious, as many of you know or may know, a serious injury or illness can deplete your family bank account. Some of you may have experienced some of that. You may not know this, but more than 60% of the bankruptcies in the United States are attributed to the cost of medical care. So in inland Southern California, we've had a healthcare crisis for way too long, and it's a crisis that we have to fix. We have to ensure that Californians receive the health care they need, inland Southern Californians receive the health care they need in an affordable and accessible way. That's what we're about. That's what we're about today. I want to thank you for taking the interest to participate and to listen to the fine panelists that you're going to be hearing from in a bit. And I look forward to working with you to fix this completely unacceptable healthcare problem in California and frankly in the nation. You know, as I close, I have had the absolutely extraordinary privilege of working with a superb teammate since January. You know, the 31st Senate District has nested inside of it 2 assembly districts, and the 61st Assembly District has been represented in a marvelous way, in a completely dedicated and focused way, by this gentleman, Assembly Member Jose Medina. And I have to tell you, of all the things that we have accomplished in Sacramento over the last 7 or 8 months, and we have accomplished some, and we have accomplished some of significance for inland Southern California, Jose Medina is the brains behind this team. So ladies and gentlemen, let me introduce Jose Medina.
Thank you, Senator Roth. Not so sure about that, but we'll take it. Also, thank you to Congressman Takano for organizing this event today. And thank you, all of you, for being here for this very important discussion. I'd also like to recognize 2 local elected officials who are present this morning. School Board, Moreno Valley School Board member Jesus Holguin, if he would stand. Be recognized. And also Moreno Valley School Board member C.J. Johnson, if he would stand as well. As a former teacher, 34 years, teacher in Riverside area schools, I know the importance of healthcare. You know, I know how important it is to have healthy families, how important it is that all children, all young people have access to doctors, have access to medical care. And the Affordable Care Act is a step in doing that, a step in making sure that all young people have access to medical care, have access to doctors. I sit in the assembly with Assembly Member Jimmy Gomez. And Jimmy got up on the floor of the assembly and told the story of when he broke an arm or needed some medical care, but his family was too poor to provide him with that medical care. And he, I think, still lives with the consequence of his family not being able to cover him. I have a 27-year-old son, didn't go to college, worked for a company who didn't offer him health benefits. Now he will have an opportunity to have health benefits. So I know how important this is to everyone in the state of California, to our region, and look forward to seeing people enroll, beginning with pre-enrollment in October, and then in January 2014, having access to health coverage. I want to just also make the same point that Senator Roth did on how proud I was when Senator Roth and I received our white coats signifying the opening of the UCR School of Medicine. Because those 55 first students, medical students at the UCR School of Medicine, also represent access to health care. And we need it in this area of the state of California more than most areas of the state. And I'm very happy that Senator Roth and I, working together, were able to do that for this area. I look forward to this being taking place. I look forward to the discussion today, and I thank all of you, along with the panelists that are going to be here this morning. And with that, let me bring back our moderator, Matt Freelander.
Thank you very much, Assemblyman. We will begin the panel in just a moment. However, I notice there's a lot of folks standing around the edges, and we do still have some seats interspersed in the group. So if you'd like to come in closer and sit down, we'd greatly appreciate that. First up for discussion is the Assistant Hospital Administrator of the Riverside County Health System. I would like to bring up Jan Rem.
Good morning. First, I'd like to thank Congressman Takano, Senator Roth. Okay. First, I'd like to thank Congressman Takano, Senator Roth, and Assemblymember Medina for hosting this event. It's a really important event. It's critical that we all learn what is truth about the Affordable Care Act, what isn't truth, and what options are available. This is the most significant healthcare change since the inception of Medicare in 1965. So we all need to know what's going on. And what I want to talk to you about today is Riverside County Health Care, okay? To understand how healthcare reform is going to come into effect, it's important to understand the timeline. Some of this has been talked about. The Affordable Care Act was passed in 2010, which immediately granted a lot of benefits to children to be able to be carried on their parents' health insurance until they're age 26, the pre-existing condition exclusions and things like that. It also afforded states the opportunity to implement a bridge program to begin to be able to provide Medicaid expansion to their residents immediately. Okay, California was the first state leading the way in the nation to implement this type of program. The state then granted each county the right to implement a program that would fit the needs of their residents. And Riverside County Healthcare was one of the first in the state to implement a Medicaid expansion program that would bridge the gap until 2014. So Riverside County Healthcare has been providing access to adults aged 19 to 64 since January 1st, 2012. Currently, we have over 25,000 members. And the goal of the program is to access ongoing health care. We all know that it's not good to have out of control diabetes, out of control heart disease. So we need to get those conditions under control. And this program is getting that underserved population those medical needs met. One of the benefits of enrolling in this program is this population will be automatically transitioned into Medicaid expansion in 2014. There's no new applications, there's no lines during open enrollment, and we're able to enroll even up until December 31st, 2013. So you can start accessing health care now with no cost to you as a family member. Okay. There are eligibility requirements for this program. Applicants must be 19 to 64 years of age. They must be a U.S. citizen, national, or legal permanent resident of 5 years or more. They must be a Riverside County resident. As I said in the beginning, each county has its own plan, and Riverside County, you have to be a resident to be in our program. You have to be at or below 133% of the federal poverty level. That number doesn't really mean anything until you think about it. What it means for a single person, they have to make right around $1,273 a month. That's not much. So we're definitely providing a need, meeting the needs of those underserved people. You can't be pregnant because then you'd fall into the Medi-Cal program, and you must not be eligible for Medi-Cal. Obviously, this is a Medi-Cal-like program, but it's not all the same benefits that Medi-Cal covers. And the goal is wellness. We want to manage those chronic diseases, and we want to give people access to preventative care. Okay. So where do you apply for this program? Well, we have eligibility workers here today that can start taking applications. We take applications at the Riverside County Regional Medical Center MISP office, at the Riverside County Family Health Centers, and at our local DPSS offices. So we have access throughout the county for people to apply. We have a toll-free number, which you can see on the screen. It's 877-501-5085. And we have a website where you can learn more about the program. www.riversidecountyhealthcare.org. It's available in English and Spanish. We have applications, formulary information, network information. Anything you'd want to learn about the program is there. Okay. We use the same application as Medi-Cal does to apply for this program, so you won't have to do a whole new application to roll into Medicaid expansion in 2014. That's one of the benefits. What do we cover? We cover the essential health benefits at no cost to the enrollees. There's no co-payments for primary care services or prescription services. Mental health services are available. We cover lab, rehabilitation services, physical, occupational, and speech therapy, diagnostic services, non-emergency medical transportation. If you can't get to your doctor's appointment and it's necessary for you to get there, we'll help get you there. We cover durable medical equipment, oxygen, walkers, wheelchairs, anything a person might need to take care of themselves, we provide. We have a nurse advice line, so you can call 24 hours a day, 7 days a week. It's 3 in the morning, I'm really sick, I don't know, should I go to the hospital or should I stay home and wait to get into my doctor? We can help you through the nurse advice line get those services. Emergency services are covered. There's no co-payments with that. So just want everybody to know that we're there to help get people into accessing their primary care physicians and get on that path to wellness, okay? We do have a closed network of providers, which is right there, as you can see, and on the website, it's available on the website. We cover everywhere from Blythe all the way out to Temecula and everywhere in between. You can have a medical home within 30 miles or 60 minutes of your home. So we try to meet everybody's needs and have a provider in every area. We have pharmacy benefits, as I talked about, and we have a pharmacy network, which is pretty robust, and you can get those first fill medications at one of these network providers. they can meet those prescription needs for those services that, there's certain medications that can't be sent through the mail, like narcotics and whatnot. So we can always fill those prescriptions at this closed network of pharmacies. But the big thing is we'll get you on mail order pharmacy. So you can have prescriptions mailed to your home, you don't have to go out. We just want people to get on those preventative medications so that they're not sick all the time anymore. And we have eligibility workers here today. The benefits of signing up today are that you can start accessing health services now. There's no waiting in lines during open enrollment period. And the biggest thing is you can start establishing a relationship with a physician today. Those preventative services are gonna be what helps control the cost of medical care in the future. And so I just want everybody to think about that and try to get some coverage if you need it. Okay, thank you. Any questions?
Thank you, Jan. Next up, we have Dr. Bradley Gilbert of the Inland Empire Health Plan. He's the CEO of IEHP, and he'll be right up.
Good morning. So the first thing I want to do is thank Senator Roth and Assemblyman Medina for getting our med school opened. I had the pleasure of interviewing applicants to the medical school. So I was one of the interviewers for individuals that had applied and were part of the final group. I don't think I would have gotten into medical school nowadays because these were incredibly talented, local people from our area. Because one of the absolute keys is you need people from the area to go to medical school, to go to residency here, and then to stay here. That's the key, and that's really the goal of UCR, is local, primary care focused applicants. And I have to tell you, I was very impressed with the caliber of the individuals that I interviewed. And I don't know how many of them got to be in the class. I'll figure that out eventually. But that's really going to help some of our issues here in our two counties. So I'm going to talk about the Medicaid expansion. As you know, in California, it's called Medi-Cal. And this is one of the two ways that there's going to be a lot more access for people to get covered. There's really two fundamental ways in the Affordable Care Act. One is the Medicaid expansion, which I'll talk about, and the second is through the healthcare exchanges. And they're different. They're different in their eligibility and who's eligible, and they're different in how those programs are administered. So you'll hear about both of those today. So starting with my first slide, which would help if I advanced it, is just a little bit about IEHP. So we're organized, we're a joint powers agency, we're a nonprofit HMO, we're local. We only cover people in these two counties, Riverside and San Bernardino. We started on Labor Day, 1996. I was actually there. And our mission is to organize and improve the delivery of quality, accessible, and wellness-based healthcare services for this community. And as you can see, we have a lot of members. So there are a lot of individuals that are part of IEHP being cared for in our communities. So what I want to talk about is Medi-Cal today versus Medi-Cal starting January 1st, 2014. So right now, you get Medi-Cal through three fundamental ways. One is you're part of a family that is low income, so parents and children. The second is you're over 65 years old and also low income. So in that case, you might have Medicare, because you're over 65, and Medi-Cal because you're low income. And then finally, there's adults with children have to pass an asset test. There's also individuals with disabilities who are also low income. So those are the fundamental ways that people get Medi-Cal now, and all of them must meet income thresholds, meaning they can only make a certain amount of money to be eligible. And it's roughly 100% of the federal poverty level, which I'll talk about in a minute, with some exceptions, which I won't spend too much time on. So the major changes that are occurring with the Affordable Care Act for Medi-Cal that are effective the 1st of January are, number one, the income level goes from 100% of the federal poverty level to 133, plus there's this 5% thing, so it's really 138%. And as Jan mentioned, this is not a high income level. For a family of 4, that's about $31,000 a year. And as Jan pointed out, for an individual, it's about $15,000 a year, which is basically minimum wage. So this is still a fairly low income threshold. It eliminates the asset test. One of the things that happens with Medi-Cal is they say, well, you're really low income, but you own a car or you own a house, and then you don't qualify. That gets removed, so it's based solely on your income. It makes the application easier, and to Jan's point earlier, it makes the transition of the 25,000 people that are in Jan's low-income health program, they move right into Medi-Cal on January 1st, 2014. And in Riverside County, we're actually helping administer Jan's program, so it will be very easy for those members. They should not see much disruption in care, and I hope no disruption in care. So this is a federally funded activity. This Medi-Cal expansion is funded by the federal government, and as you can see initially, it's completely funded by the federal government. So there are no state dollars and there are no local dollars. I wouldn't stare at this slide too long because it's quite complicated in the sense of the different income levels, but basically what it tells you is that there are 3 fundamental ways that people are going to get covered through this program. Medi-Cal, and you can see different income levels depending whether you're a child, whether you're a pregnant woman, et cetera. The Health Exchange or Covered California, which is going to be talked about next, and then of course Medicare for individuals that are 65 years and older. So now what I want to talk about are the other fundamental changes to Medi-Cal. So number 1, remember, was the income level was raised. That was first. But the second, and this is the major change, is that childless adults, so adults that do not have children, are now eligible. So at the moment, other than through Jan's program, they have essentially no access to insurance, if you think about it practically, because they don't have the dollars to buy insurance in the private market, and they're not eligible for Medi-Cal. So this is the major reason that many more people are going to get access to health care. The fact that individuals that are low income and do not have children will be eligible for Medi-Cal. Adults with children over 21 that are still dependent upon them, not insignificant, but not as big as that first group. Parents of existing Medi-Cal children who currently fail the asset test, so that example I gave, I own a car, I own a house, no longer part of the eligibility process. Former foster youth. One of the things that happened under the current Medi-Cal program, which I saw as a real problem, was I'm a foster child, I have Medi-Cal up until I'm 21, and then the system says goodbye. Now they get covered through Medi-Cal up to age 26. So for example, they can stay with IEHP. And then as we mentioned, the current low-income health program enrollees, Jan's program, those individuals move right into Medi-Cal on January 1st. This is a lot of people that are now eligible. In the 2 counties, it's over 250,000 people in those categories who are now eligible. So this is a very significant expansion of the ability of people to get coverage. You can see kind of how it breaks down for Riverside. As you would expect, most of the individuals are in what I'd call Metro Riverside, which would include Moreno Valley, Low Desert, Coachella Valley, et cetera. You can kind of see the numbers, but really very significant numbers of people that will now be eligible in January. And of those, about 50,000 are in the 2 low-income health programs. The benefits are very, very similar, essentially identical to Medi-Cal today. There is a little piece that is still being worked on where some of the long-term support services like in-home supportive services or long-term care, the state is talking about for those services requiring an asset test. It is not clear that the federal government will approve that, but all the rest of the Medi-Cal benefits through IEHP, and I'll talk about the plans in a moment, will be available. And the county also has an opportunity to provide enhanced benefits for individuals struggling with substance use. And then good news, and the senator made a very important point, restoration of dental benefits for adults in Medi-Cal, May 2014. It's been very difficult. The senator's example, every day we have members calling us saying, I've got these dental issues, what do I do? And the dental is provided by Denti-Cal, we don't really have much to help them with. We are all hopeful, if I had some wood to knock on, that the enrollment process will be much easier. There'll be multiple ways to enroll. You can do it online. You can do it through the county. IEHP is going to be assisting. We have an enrollment unit that helps assist. You heard Jan, there's individuals here and will be in the hospitals and other places to try and make sure both Medi-Cal and Covered California, it makes it easy to apply one process, and then the system figures out where the application should go. So there are 2 health plans available. This is different. You're going to hear it different from Covered California. So in the Medi-Cal, for people that get Medi-Cal, there are 2 health plans. One is Inland Empire Health Plan. We are a local, not-for-profit health plan. We have 750 primary care doctors, between 750 and 800. We have over 2,000 specialists in our network in both counties. So we have a lot of capacity. I was talking with Congressman Takano. One of the challenges for all of us in the Inland Empire is we don't have enough primary care doctors. And in certain specialty areas, we don't have enough specialists. I heard, this is one story, one of our ENTs called me the other day. He's a little younger than me, I'm 56. He said, I'm one of the youngest ENTs in the 2 counties. We need some younger ones to come in and serve us. So a very large network. The second plan is Molina Healthcare. They are a for-profit health plan. They serve Medicaid and Medi-Cal members in multiple California counties and other states. So individuals will have a choice between these 2 health plans. At the moment, IEHP has about 80% of the Medi-Cal members in the 2 plans, so we are the larger health plan. The last thing I want to show you, kind of a complicated sheet to put on a slide. We have them in the back at our IEHP table, both a Medi-Cal expansion fact sheet and a Covered California Exchange fact sheet. So please pick those up. You can also pick up, we have a fun little cell phone holder in the back, so you can visit our table as well. So that is the story about Medi-Cal expansion. We're going to hold questions till the end and bring up the next speaker. So thank you very much for allowing me to be here.
Thank you very much. Before we bring up our final speaker, I just would like to remind everybody to turn in your Q&A cards to the staff if you still have them. After our next speaker finishes, we'll no longer be accepting cards. I've already got a few up here. So without any other further ado, I would like to bring up the Associate Director for Insure the Uninsured to talk about Covered California. I'd like to bring up John Connolly.
Good morning, everybody. I'd first like to thank Congressman Takano, Senator Roth, and Assemblymember Medina for letting us all learn about this today. Some really important things are happening and coming soon, as you're going to learn. And so I'm here today to just sort of introduce, as a member of the Insure the Uninsured Project staff, what's happening with Covered California. They have sort of fanned out all over the state, all the way from Redding to San Diego, Central Valley, Central Coast, to sort of educate folks, and they have enlisted some of us in their network to help educate people. So this is just a presentation to sort of introduce you to the new sort of innovation of the Affordable Care Act in terms of the coverage expansions. Covered California, as it's known here in California. So this is our health insurance exchange. It is brand new. Enrollment will start on October 1st, as I said. That's coming very quickly. And coverage will begin on January 1st. So let's learn a little bit about what's happening. So the first important question is, are you already insured? Either through your job, could be Medicare, could be a VA plan, something like that. If you're already insured, you can keep what you have. In fact, in many cases, you can't access some of the coverage through Covered California if you already have coverage. So this is really for people who are A, uninsured presently, so if you don't have coverage now, or if that coverage is deemed unaffordable. So that's the first question you need to sort of ask. Am I insured already? So if the answer is yes, as I said, you can keep your coverage. That's the good news. You might have heard a lot of elected officials say if you like what you have, you can keep it. But there are new protections and new coverage through the Affordable Care Act. So if you do not have coverage right now, Affordable Guaranteed Quality Health Insurance is on the way through Covered California. As I said, enrollment begins October 1st, coverage January 1st. So why don't folks have insurance? What are some reasons? One that has been mentioned already is a pre-existing condition. So if you have a pre-existing condition as an adult up through January 1st, you can be charged a whole lot more than somebody who doesn't have one, or you can be denied coverage, but soon that won't be the case. So as we've talked about already, that's going away. The second thing is, your employer may not choose to offer you insurance for whatever reason, so that may not be available to you. And again, the third option is if you're trying to buy insurance for yourself and your family in the individual market, it just might not be affordable. It's not something that you can sort of cover for your family. So what are some coverage improvements in the Affordable Care Act? And again, many of these have been mentioned already, but just to quickly summarize, guaranteed coverage. So if you want coverage, you can buy it. You cannot be denied. No annual limits, as the congressman said. No denials for pre-existing conditions, and rates are not based on health status. So you cannot be discriminated against based on your health status. It also requires large employers, that's with 50 or more full-time equivalent employees, they must offer coverage, and that begins January 1st, 2015. So that's in a year. Also, affordable coverage will be available, public or private, and that's required for individuals. So that's a personal responsibility element of the Affordable Care Act. So what are some of the coverage improvements? We've talked about the essential health benefits already. Dr. Gilbert mentioned that. And a whole slew of services must be covered now. So they can't just exclude maternity coverage now. That must be covered. Prescription drugs, inpatient, outpatient, habilitative services, pediatric dental and vision, for example. All of those are covered. So these have to be comprehensive plans, and they will be offered through Covered California again on the first of the year. So who's eligible? As I said, basically folks who do not have insurance presently. This is a new option for you. Second, if your coverage is unaffordable, especially if you're out, and also for folks buying individual coverage on the individual market. So who cannot purchase through the exchange? Undocumented immigrants may not purchase through the exchange, and that's with or without subsidies or premium assistance. So they are not eligible to purchase. And also currently incarcerated individuals, they get their health insurance through the prison health system, so they will not be eligible as well. So who is Covered California, and also who are they not? So a little bit about that. They are operated by the state of California. It was the first state health exchange formed under the Affordable Care Act. We are fortunate to be in California because our state has aggressively and very excitedly sort of implemented a lot of the planks of the Affordable Care Act, and they've done a really I would say, exemplary job. Second, they have established the Health Benefit Exchange here in California. It's one of 17 state-based marketplaces in the country. It is a .com, but it is state-run. So these are folks appointed by state officials to sort of set this up to the best of their ability. And they will be offering, and this is an important point, as distinct from what Dr. Gilbert was saying, this is not Medi-Cal. So this is private insurance. These are name brand health insurance policies, and we'll talk about some of the insurers that are offering coverage through the exchange. So what's some of the guiding principles and what's the vision? First of all, to improve the health of Californians. That is the ultimate goal. And as a part of that, we want care to be more accessible and also high quality. So the mission is to increase the number of uninsured Californians, improve quality, as I said, lower costs, reduce health disparities among different communities, and also provide choice and value on behalf of the consumer. So, what are they going to offer? So, affordable health insurance, and part of that is that premiums are going to be based on income. So, if you are lower income, your premiums will be smaller if you're more middle income. Copays will also not be a deterrent to care. So, for those with lower incomes, there will also be help with copays and deductibles. There's zero deductible, in fact, for many plans. And free preventive care. That's a key element of the Affordable Care Act. So there's no copay for preventive care. Also, lower out-of-pocket maximums annually. So there's a cap on how much you can pay out-of-pocket for your health insurance plan over the course of the year. So, These are just some plans in different counties around the state who will be offered, and many of these are familiar sort of plans: Blue Shield, Kaiser, Western Health Advantage, Health Net, LA Care in LA County, Molina has been mentioned before. They're also offering an exchange product. So many familiar plans. So these are the same insurance companies offering their coverage through the health insurance exchange. And what the state has done is say, we're going to negotiate on your behalf for a good value for you with these familiar sort of insurance plans. And these are the folks who offered the best value. So these were competitive bids. So we've talked again about some of the plans available, and some of them are also sort of community-based plans, nonprofit plans who have also offered health insurance within the Medi-Cal space as well. So there are also those sort of local regional plans that will be available. There will be coverage also for small businesses. We have the Small Business Health Options Program, or SHOP as we affectionately call it, that will be available for employers who have less than 50 employees. And there will be tax credits available for employers who would like to purchase. So up till the first of the month, 35% of premiums for employers with less than 25 employees are eligible for tax credits, and that's up to 50% of the cost of premiums for small employers beginning on the first of the year 2014. And also the SHOP is offering plan choice for both the employees and the employers. So who are we not? This is not government insurance. It's not Medicare. It's not Medi-Cal. It's commercial insurance. So as I said before, some of the usual commercial insurance plans offered in California. These are not government doctors. These are not government hospitals or pharmacies. Again, this is private insurance. It's not socialized medicine. So this is, like I said, it's a private product, simply negotiated prices by the health insurance exchange. And the goal is to lower, not raise, the cost of everyone's insurance. So part of pooling everybody together in an individual market is to get a better deal for the consumer, so you're not out there by yourself negotiating your own price. It's also not a government regulator. There's already a Department of Insurance and a Department of Managed Healthcare in California doing that work, so the exchange is not a regulator. So this is just sort of a set of milestones that basically the exchange has already either met or ones that are coming soon. So as I said, the key ones to keep in your mind are first open enrollment as of October 1st. That's in about 5 or 6 weeks. In January, coverage begins. The first open enrollment ends in March. So if you need coverage, you need more affordable coverage and you don't currently have it, you're out in the individual market, for example, get in before March, and if you need coverage soon, you should do it this fall. By 2015, I should note, the exchange will be self-sustaining, so that means they're bringing in fees from the health insurance plans. It's not tax supported as of 2015. They have to be a self-sustaining entity funded by fees from the local insurance plans here in California. And I should note the enrollment goal is 5.3 million as of 2017, so that's quite an ambitious goal. As we've talked about the millions of Californians who need coverage, they're aiming to get 5.3 million enrolled. So, making care more affordable, what does that mean? 2.6 million Californians are eligible for subsidized care. So that's folks who will be eligible to get some assistance from the government with their premiums and their copays. They will pay a percentage of their income, and basically the government, the federal government, will cover the rest. So you will just pay your share, and then the Treasury will cover the remainder of your premium. As I said before, out-of-pocket costs will be lower for those with lower incomes. The government will basically help health insurance companies sort of cover a share of copays to providers. So that's going to basically bring down costs quite a bit for those who are basically low to moderate income in the exchange. So this is sort of what premium assistance looks like on a sliding scale. So as Dr. Gilbert said, if you're around $15,000 at 138% of poverty, which is where Medi-Cal ends, so around $15,000, your eligibility is sort of begins at that rate. And if you're all the way up to $45,000 or $46,000, if you're an individual, that's sort of where the premium assistance ends. You can still purchase above that, you won't have the premium assistance available to you. And then there are the numbers for larger family or household sizes there. So there are different tiers of coverage, bronze, silver, gold, platinum, all of the precious metals you may be familiar with. And sort of what that sort of corresponds to is the share of cost you're going to pay for upfront in your premiums. So if you want to pay for if you want the plan rather to cover 60% of your expected medical costs in a bronze plan, you're going to be basically on the hook, I should say, for 40% in cost sharing when you see a physician or when you get a prescription drug. So that's sort of a decision you have to make for yourself or your family about the kind of coverage you want. And that ranges all the way up to platinum, in which you will basically expect the plan as a result of paying your premium to cover 90% of the share of costs, and then you would pay for 10% later at the point of service again when you see a doctor or pick up a prescription. So this is an idea of sort of what some copays would look like within the standard benefits across the different metal tiers. So for gold and platinum plans, there is no deductible. As you can see, there are deductibles for the bronze and silver. And then you see sort of what your copays are for different types of visits: primary care, generic medication, an emergency room visit, and then your out-of-pocket maximums at the bottom there. So there are lots of numbers on here, and I should note that these are costs before the cost-sharing subsidies available to those with lower incomes are available. So this is without that extra help. So this is sort of the sticker price, so to speak. So again, your primary care visit, your copay would be $45, and that's if you're not eligible for a subsidy for copays. The maximum out-of-pocket for an individual for a full year is $63.50, and again, that's sort of without any assistance if you choose a plan with a higher sort of cost-sharing burden for the consumer. So, again, the sliding scale benefits for a single person, starting at $15,000 roughly, which is where eligibility begins for Covered California, all the way up to roughly $46,000 at 400% of poverty, which is sort of how this is calculated. And you can see sort of how the benefits or cost sharing will change as your income goes up. So it's quite affordable for lower income folks, and it rises gradually across the range there of incomes. So that's just to give you an idea of what sort of the out-of-pocket burden would be for different individuals. And again, this is for a single person. So yeah, just to recap here, the consumer portion of the monthly premium would be $19 to $57 at the low end of the income range for a silver plan if you were to choose that metal tier. Primary care copay, again, $3. So that would be the out-of-pocket. How are rates determined? So the Affordable Care Act basically places some restrictions on how rates can be calculated after the first of the year. So they can only be based on three things. First of all, your age, because older folks, as a lot of us are familiar, have higher healthcare costs than younger folks. Your zip code can sort of have an effect on your rates, and that's because certain healthcare markets are more expensive than others. In addition, the household size and income. So the more folks in your household, the higher your premium might be, as we know. Family coverage might be more expensive than individual coverage, and also your income, and that's factored in because folks who are lower income or moderate income can get some premium assistance or subsidies to help you with the cost of insurance. And also, finally, this is an important one. This one depends on you. So you sort of make a choice about what the best plan for you is, and that would be sort of both the health plan within the tier, so it could be Anthem or Kaiser or whatever, or the metal tier itself that you choose. So you make a choice of both the plan and the metal tier. So that one sort of depends on what's right for you. Rates, we should note, are not based on gender anymore. That cannot be a rating factor. They cannot, again, as I said, be based on health status. That's no longer permissible. Pre-existing conditions or tobacco usage. So California decided to omit that one as a rating factor. So just to give you an example of what an individual here in Riverside County might be eligible for. This is an example, a fictional guy named Jose, and let's say he's 27, he's single, and he earns about $31,000 a year. He has no dependents, and the rating region that we're in here is region 17. So there are different prices in different regions, so this is an example for our rating region right here around Riverside. So these are the prices that are available to him. So you see the premium in that first white column, the premium assistance that's available to him, which is $0 given his income and he's a single guy, and sort of what the plans are sort of offering sort of ranges from $204 for the HealthNet PPO up to $248 for the Kaiser Permanente HMO. So you have a range of options there. You can sort of check out what their provider networks look like and make a choice that you're basically comfortable with, that you feel is best for you. So that's sort of what would be available to somebody in his sort of demographic description. So let's check out the Taylor family. This is another example of somebody who might, or a family that might be shopping for exchange coverage. You have John, who is 42, and Maria, who's 40. They are married. They have an annual income of $58,000 and 2 children, 2 dependent children at home with them, also in rating region 17. So for a family of 4, this would be what would be available to them. So you see the premiums, because of family size, do go up noticeably there, but they're available, rather eligible for premium assistance. So the federal government is willing to help them with their premiums up front, and so their share is in, again, the yellow column on the right. So that's sort of the options that are available to them here in Riverside, given their sort of profile and income and family size. Okay, so a little more about outreach, education, and marketing. How is this all going to sort of filter out to all of you, folks in the community who might need help or coverage? There we go. So, outreach and marketing. So, obviously the goal is to maximize enrollment and make sure that folks who get some help and get a better deal with their insurance have access to that. So it provides Covered California provides one-stop shopping for affordable, quality healthcare options, and the goal is, with a standardized package of benefits, no matter what plan you choose, the benefits that are covered will be the same, but some of the prices and coverage levels do vary, as I said before. It depends on what share of costs you want covered up front in your premiums. But the goal here is to make it a transparent shopping experience. Some have sort of compared it to Orbitz. It's probably a little more complicated than that. Maybe TurboTax would be a better comparison. You know, when you file your taxes, it takes a little time. Health insurance is sort of an important expense that you have to think about a little bit. But the goal is to provide an online sort of marketplace where you can make some comparisons and decide what's best for you. And also to educate Californians about the benefits of coverage and what's available. So the overall goal is to build a culture of coverage and sort of provide information about what insurance is out there and what assistance is available. So the folks that Covered California is trying to reach. So who's the target audience? Basically the 5.3 million Californians who are either currently uninsured, as I said, or purchasing health insurance in the individual market on their own for them and their families. And so, as I said earlier, 2.6 million, that's quite a number of people, will qualify for some help either with their premiums or their copays, or both. And 2.7 million who don't qualify for subsidies, but could benefit from the guaranteed coverage that Covered California is going to offer. So because Covered California said, we're going to negotiate on behalf of all of you as a pool of purchasers here of insurance, you may be getting a better deal within the exchange than you would presently. An additional 1.4 millions will also be, as Dr. Gilbert said, eligible for Medi-Cal. So this is sort of a range of incomes on top of Medi-Cal to provide an extra option in the private insurance market for those who have too high incomes for Medi-Cal. So just to give you an idea of where the uninsured and the eligible sort of folks are for Covered California across the state, obviously most of them are in Southern California. Right here in Riverside County, 180,000 people are basically subsidy eligible for Covered California. So that's quite a group of people. So if you think this might be an option for you, definitely check out what's available on coveredcalifornia.com. So how is sort of this outreach network going to function? There are many different types of community-based, faith-based, insurance brokers, organizations out there trying to get people educated about what's available. So the whole goal is to reach people where they live, work, shop, and play. And it's a very diverse network of outreach and education sort of organizations. So that's 250 organizations reaching consumers. The goal is to engage 9 million Californians and 221,000 small businesses throughout the state in all major languages. I think there's a figure coming up about how many languages that they can speak to you in through the service center. And it's impressive. So again, as I said, community-based organizations and other entities supporting Covered California. And the purpose is to raise awareness and promote a culture of coverage. So, if I want to get involved and help people get educated about what's available for them, what should I do? So you can go to basically community outreach network at covered.ca.gov, and you submit an interest form, you sign an agreement, you get some information from them, and then you go out and spread the word so that if you want to be a part of educating folks, you can get involved. So, smooth enrollment. How is this all going to work? Dr. Gilbert talked a little bit about this before, but they're trying to use trusted and known channels. So 50 to 75% are estimated to need help with purchasing insurance in this new sort of marketplace. It's kind of a new object that people aren't really familiar with at this point. And so they're trying to help folks figure out how to make good choices for themselves. So there will be in-person Covered California certified enrollment counselors, and they will be out in the communities to help you at different faith-based, community-based organizations. Also, your local friendly and helpful insurance broker, they can help you. I mean, it's a private insurance product, and they will be educated about this. You can also call the Service Center for general questions, to enroll completely through the phone. There will be folks to help you there. And also with retention and support. So they're there to help you sort of sift through the options that are available as well. All right, so there will be one application, as Dr. Gilbert mentioned, because folks might approach the Service Center knowing that they need more affordable coverage, or knowing that they need coverage, period, and they may not know if they're Medi-Cal eligible or Covered California eligible. So there's one application. There's no wrong door. If you call the Service Center with the exchange and you say, I'm looking for coverage, and they say, guess what, you're Medi-Cal eligible, they will refer you to the right place. You won't have to go somewhere else, and they will basically allow you to sort of get through that whole process in one sitting. And so these are just sort of some ways, as Dr. Gilbert said, that you can apply for coverage. It can be on the phone, via fax, all kinds of different ways, online. It can be at a local or county office as well. So what will you need to provide them to get enrolled? Your social security number, your income information, and your income tax filing information. And that's, again, to sort of figure out what sort of help you might be eligible for with premium assistance or cost-sharing assistance. Enrollment dates, as I mentioned before, this all begins in terms of enrollment on October 1st. That's coming up quickly. Runs through March 31st, with coverage beginning on October 1st. Subsequent enrollment in following years will only be in October through December. It's longer this year because obviously this is a new program. People might need some time to get sort of educated about what's out there. And also, this is an important distinction, Medi-Cal applications are accepted year-round. So you can apply to Medi-Cal at any time. There is no sort of open enrollment period, but for Covered California as a private insurance product, it operates just like employer-sponsored insurance or Medicare, in that there's an open enrollment period in which you choose the plan for the upcoming year. I should note there is one special circumstance. If you have a life-changing event like a divorce, a job loss, a death in the family, something like that, that changes your insurance status, you can enroll outside of the enrollment period. That's an exception, but it must be within 60 days of that event. So that's sort of the requirement there. All right. So there will be a consumer-friendly website that you can check out, coveredca.com, that will help you sort of get through all of this information. I realize this is a whole lot of new information. So you can spend some time on your own going through what options are available for individuals, families, and small businesses. And representatives are available now if you have questions. So starting August 19th, Monday through Friday, you can call somebody at their call centers. They have 3 of them. And after October 1st, they're adding hours on Saturday, so that's 8 to 6. And they have interpretation services in over 300 languages. So it doesn't matter what your language spoken at home is, they most likely will be able to help you. So again, helping consumers enroll, as I said, there are going to be certified enrollment counselors in community and faith-based organizations around the county here, and also your insurance agent can also help you sort through what might be best for you. Let's see here, moving forward. And that's it for today. I realized that was a lot and that was kind of fast, but I think it's good at this point to open it up to some questions, so I'll turn it over to our host.
Thank you, John.